Welcome back to Cool and Chronic with me, Simone. And today I'm joined by the lovely Sophie, a chronic ill advocate from the UK who lives with multiple chronic illnesses, and she shares her journey online so other people don't feel alone. I'm here and we're going to be talking about many different things, but we're going to hone in on Crohn's disease, living with a feeding tube, including challenges, how she works in a full-time job with the NHS, and just so many amazing things. What you share online, Sophie, is amazing, and that's how I found you online. So thank you and welcome, Sophie. If you want to tell us a little bit about yourself and your many chronic illnesses, please go. You've got it going on.
Hello. So thank you, Simone, for having me. I'm Sophie. I'm from the Midlands.
Yes,
we share the same accent.
We do.
I'm 30, recently turned 30.
Okay.
My journey started when I was like 13 with septicemia and sepsis, and before that I was like a completely healthy, hardly had any problems.
Wow.
And then it kind of all just went for a few years, and then I ended up with this Crohn's diagnosis and collected many diagnoses since then of you've mentioned and touched on about the feeding tube. I've got gastroparesis. I have Ehlers-Danlos syndrome, which is under genetic testing at the moment.
Wow.
And I've got things like bowel prolapses. And then on top of all of that, I also have POTS, which affects just being upright as a challenge.
Yes, being sat upright, yeah.
Yeah, so if you see me doing this, it's just,
you need to do it.
Yeah, and then that's kind of what I would class as potentially my physical health problems. And then I've also suffered in the past with mental health problems, so quite severe anxiety, depression. It led to a diagnosis of OCD. And then I went underdiagnosed for quite a long time with dyslexia and dyspraxia. So just a few things, just a shopping list.
Yeah, but so you literally have been to the shop, haven't you, Sophie? And you've just gone beep beep beep. This is, but I know we're laughing and smiling. And for those who can see Sophie, she is smiling and she looks so beautiful and glamorous. But it honestly must really get you down. And we are going to get into I'm really happy that you've spoke about the mental side already, you've brought that in, because I think a lot of people with chronic illnesses, it comes hand in hand having a mental illness or come in because you've been chronically ill, because our lives are so restricted, aren't they, Sophie? And or you've had that for your whole life. So I can relate with the anxiety, exactly the same. I think I've always been a little anxious person. I don't know if you agree. And then it just heightens up with your illnesses, doesn't it?
Absolutely.
So you've got all these diagnoses going on, right? And you're under testing for MCAS. Am I right in saying that as well?
Yeah. Wow. So it's a bit of a strange one in the UK, that because of the way that the NHS works, and as a fellow NHS worker, there's so many things I wish I could change about the NHS, but that being their MCAS symptoms. So I mean, I've got all random rashes come up at the moment for completely unknown reasons why they happen. So I'm treated for it with a couple of different medications, which you can touch on later.
Yeah.
But they won't put it officially on my record. They've only got allergies on there. They won't officially diagnose MCAS. And there's very few. There's a lot of people that have quite a lot of these POTS and comorbidities, FND, IBS symptoms, and also suffer with all of these allergies that are very unspecific.
Yeah.
There's hardly any kind of chronic illness specialists in the NHS that will deal with it.
I know, I've heard this from other people as well, and it's almost like you have to pay to go private for your it's quite a lengthy challenge to try and get a diagnosis. I'm right in saying that, aren't I?
Yeah, definitely.
Draining though, isn't it?
And I'm at the point now whereby, we know what a lot of my allergies are, but we know the medications work, because if I didn't have the medications, this would all be a lot worse.
Yes.
But they still won't officially put it on your record. And a lot of people with chronic illness, throughout the whole spectrum, find this and I've said it's taken me years to get a diagnosis, and in that point it's dragged your mental health down because you're thinking, oh my word, am I going crazy?
It does that though, doesn't it? And you think, and I'm sure anybody listening, the whole, we have to advocate for ourselves. And I'm 32, you're 30. Like, we're not, you know, like, we're still quite young in the sense of to be disabled / chronically ill. We are quite young for that. I mean, you're 13 with your first, I mean, no one else probably at your school or around you at the age of 13 knew what your illnesses probably were, did they, at the time?
No. And to be honest, when I was, so once I'd kind of got over sepsis, I was on medication for quite a while, things just were never right. And then I ended up with the whole like glandular fever, and then it was like, you know, the post-viral fatigue. But me being me and having, at the time I didn't know I'd got OCD, but I've got this like internal like huge fear of failing, fear of letting people down. And I've always just been that sort of people pleaser person that like I just push myself. Yeah.
And we are.
Yeah, and I'd still like, I was, you know, I danced at a really high level as a competitive dancer. So like my teenage years and my early 20s were, I was always unwell with my stomach. I'd always got the stomach problems. I was always being told by dietitians, try this diet, or cut gluten out, do this, do this, do this. But I was still lived a relatively normal life at that point. You know, I still pushed myself. I was still, but the amount of times that I'd be at work and not very well, like before I worked in the NHS, and, you know, the managers would sit down and you're burning the candle at both ends, you're burning the candle at both ends. And it's only as you've, you know, you do get to the point where the body goes, absolutely not, I'm giving up on you now. You have pushed and pushed and pushed to the point there's no return. You're not listening to me.
See ya. Does that though, doesn't it? And what was that turning point for you? Like, so when was that time where we almost say like it's almost like a crash and a burn, like that big crash that makes you think, okay, I'm going to listen. When was that, if you don't mind talking about it?
Of course, no, not at all. So back in like 2021, I was just getting really unwell. Like throughout the pandemic, I'd started to get worse again. Then 2021 was when I started to notice, like, so I know we'll touch on it a little bit afterwards, but with like the Crohn's symptoms, like more bleeding in my stool, so like not just now that the foods were making me unwell and sick and, you know, changes in bowel habits, I was losing a lot of blood and things like that. And then I had like a bit of it was quite a big relationship breakdown, and the stress of all of that triggered everything to like just kick off 100 times more than it ever did. So like I lost 2 stone in like a matter of weeks, and just really unwell really quick. Still, I was trying to still dance, and I was going in there and throwing up sessions. I was literally like dragging myself into work, not eating in the day at work because I would eat and then be sick, which at the time was my Crohn's, but not diagnosed. Okay. And I did that for 6 months, carried on, just doing it. And I literally got to the point where I'd been bleeding so much. I collapsed in A&E. The next thing I know, I'm like in resus with defib pads on me. And I'm like, this isn't the point that I'm supposed to be. I help the patients that have been in this situation, not me.
Yes. And you're thinking, what's happened to me? Like, how has this happened?
Yeah, and it was at that point that it scared me then, and I was like, oh gosh, like, and that's, I think I'd never really, even though I worked in cardiology, I never really put 2 and 2 together with like the pot side of stuff as well. It was only when things got that bad and my body literally went, no, overnight. It was really? Like you pushed it too much. Yeah,
it almost just had enough. And if you don't mind talking about, so obviously there's so much, you're
very open.
I was about to say, well, get it out there. So with dancing, I don't know, so you've danced your whole life?
So I was a gymnast from the age of around about 7 or 8.
Wow.
Which, you know, the naturally flexible side of things, which comes to bite you in the butt as you get older.
Yes, it does. That is a symptom, isn't it? Those people who are like, what is it? So you're double jointed as well, aren't you? With
big head. Everything just
if you can
moves,
see on the
not ways that
that's
it should
like a test, isn't it? And like they test that when they diagnose you. Am I right in saying that?
Yeah.
And so for you, that must have been great for gymnastics. But now there's so many other conditions with heads. I'm right in saying that. Am I saying it right? That like you said, that overlap with other conditions, and a lot of it is POTS, I believe. That's, and also they're very close. You working in cardiology, you'd think that, people would be like, didn't you know? But of course because it's you're not, and obviously you said you're a people pleaser, and I will have my hands up, me too, until I've got ill. You can't be anymore.
No.
You can't do it anymore. It's just your body is our brain and body is probably saying, you've been too nice your whole life, let's stop now.
Literally that. Yeah,
it just stops. But obviously, so you're going through, when you spoke to people at work, were they like, were they a bit like, we kind of knew this, we should have pointed you in the right direction, or?
Not really. I think at the time, again, so much was going on. I mean, like the cardiology consultants were, they were really nice with me because I'd already knew them at the time as well. So like there was a couple that were aware of like what was going on and, pointed me in the direction of a few things. But again, even now, 4 or 5 years later, people still don't know that much about POTS, even though I work in cardiology, even though, we do get a referral. Like I see patients now with POTS, but it's more a case of, oh, well, we know Sophie in cardiac rehab that she's got POTS, as well as, we've given these patients these meds and let's go and give them to Sophie for rehab, because you've got more of that hands-on experience as well yourself.
You're living with that condition, like you're living, and they know they can, which, you know what? Okay, it sucks for you because it really does, but it's actually quite good for the NHS that they've got you that can, do that for them. That's brilliant. Like, and I bet you enjoy like meeting people you can talk about it to, maybe.
Absolutely, and I think as well, I don't know too much about your own background, and when you've been told time and time again by healthcare professionals from kind of like 15, 16 with all like the fatigue elements and that side of stuff, and then my bowel problems, and we'll just manage your stress. It's oh well, it's just in your head. You just need to calm down. You're just anxious.
You're just anxious, which anxiety can give a lot of other symptoms, and I'm not taking that away from anybody at all, but they basically told me I was having a nervous breakdown. Obviously I've got FND, which is fine, but having a nervous breakdown doesn't make you shake like Beyonce for months and years on end, does it? Do you know what I mean? I was like,
but you shake a bit like Beyonce more than anyone else, so you know what I mean? The winner.
I'm the winner. But I agree with what you're saying, and then you're fighting. I think it's only been recent. I'm 5 years into my journey, but looking back, I've always had symptoms and things. But you being 13 and then you've really only been taken seriously now, by the sounds of it, like within the past 4 or 5 years. Am I right?
Absolutely. And, even like a few years before, I think it was like 2018, 2019, I'd had endoscopies that had shown that I'd got inflammation, and because everything, it just kind of got brushed off when I was a bit younger and that sort of stuff. And then you just start to think, when you get these symptoms, oh, it's just my anxiety again, and I'm worrying myself about it. And you get to the point of like, this healthcare professional, what's the point of going to this appointment, because they're just going to tell me the same as the last 10. And I think working in the NHS, and whether it's with my my standard cardiac patients that have had the heart attacks, that have had the open heart surgeries, or whether it's the patients that have got the long-term conditions like fibromyalgia, FND, POTS, and actually sitting down and saying, I understand, I believe you, I'm working with you, I understand every day is not the same, but we can make some positive changes going forward. I like to think, and the feedback I've had has been really, really positive, but I like to think that they're not just saying that, they do genuinely mean that.
If you said that to me, I'd probably cry, because the fact that even you saying it then made me, and anyone listening who's got a chronic illness, if everybody took that approach in the NHS, the life for chronically ill people would be so much better, because it is half of a, you can't always see these illnesses. Like, if I was to look at you, yes, you've got a feeding tube, but you look so beautiful. And I think you did a post about this on your TikTok. The way we look, and me and you, we've got our makeup, make an effort and stuff. We look fine, and then one day someone can see you and you're fine. The next day, not so much, sort of thing. Yeah. So I think you saying that, I would hold my hands up and say thank you to anyone you've looked after, because that's incredible that you're like that. And I think more people should be like Sophie. If you work with the NHS, listen to this girl and follow her. What's your Instagram and TikTok, please, for people listening?
I mean, I don't really use Instagram much for like
sharing of stuff.
Yeah, I keep that quite like private with like my family and friends and that sort of stuff. But like with TikTok, it is Sophie May 66, and I bore people on there with it. That's why I think my family and friends that want to hear it and want to see it, that'll go and check it out on my TikTok. But you know, the ones that I see day in day out, I'm like, you know,
I don't need to.
I'm sorry, you don't need to hear this all the time. But you know, I could be put off by saying, oh, I'm not going to post it all together because I'm worried about what people that personally know me are gonna think. And I have thought that in the past, but then at the same time, I feel like the amount of positive like messages and people saying thank you so much for sharing this, and also how I felt seeing other, you know, people that have posted about their health journeys, and I've reached out to them and said, you know, no one in my life understands what it's like to have a feeding tube, you know. How do you find that you feel like this, or do you find that you feel like this? And it's having that, like, I did a bit of a rage bait post a few weeks ago about like having it like some of my illnesses in my name, but I think it makes it very clear to someone looking that, look, come to me if you've got questions about XYZ. I'm happy to speak with you.
Yes, and I really resonated with that actually, because I saw that post again. Go and follow Sophie on TikTok, and it basically I like it because if someone has your condition, they're newly diagnosed, they want to know about feeding tubes and Crohn's and anything, they can just follow you, and then they know, okay. And I really like what you've just said, that you've got two separate things, because I found that because I was a personal trainer and like you, we were very physical, fit and healthy, and I now use that page to share a bit of my life but also a bit of fitness and stuff. But I mainly now use the Cool and Chronic podcast to share everyone else's journey and mine. And I always say, look, I'm not a doctor, you're not a doctor, you're in the NHS, so you're a heads up on me. But you know, if anyone was to, if we're going to look into Crohn's, I'll just put, if you wouldn't mind, could you tell us like the symptoms and what to look for if you were, that's that. What would you look for Crohn's? That would help.
I guess as well that was probably my starting point to start to speak about my health online, was with Crohn's, because it's invisible, you know, unless you see me when I'm pale and, you know, gaunt and, you know, I genuinely look unwell, that I'm in an active flare-up, you wouldn't know. And I think a lot of people think that Crohn's is just a toilet problem. So it's actually an inflammatory bowel disease. So for anywhere from your mouth all the way to your bottom and all of your digestive system in between, any parts of that can be inflamed. And as a result of that, you know, the physical inflammation, it affects people differently. So some people get a lot of like sickness, whereas other people might get a lot of kind of diarrhea. Some people have constipation, the loss of blood. It can affect people, you know, people's entire small bowel, and they end up with intestinal failure. And you know, there's so many different reasons just with the bowel symptoms.
Yes.
So people just think it's, oh, you've got Crohn's disease, you go to the toilet a lot, and it's so much more than that. And I think that was something that I really tried to post about, was because, you know, I had comments of, well, you look fine on your social media posts, you look fine yesterday, oh, you look lovely, you know, and you can't see that. If you could see on my arms all these big, huge, you know, scabs and ulcers, and you know, your skin's all swollen, people would react completely different. But
exactly that, whereas you can't see it. If you were to give a bit of advice to somebody, because obviously you've got Crohn's, but you've also got the gastroparesis, which is another thing added on, and we'll go into that next. But if someone was to, they first had, like, say, a bit of blood in the poo, and obviously we want to, what would the first what would you say to do, basically, for a bit of advice?
So the first thing is, if you notice blood in your stool, doctors straight away, your GP, and get a stool test. Now, there again, over the last few years, the awareness around bowel disease and also bowel cancers, because blood in your stool isn't just means Crohn's. You know, there's hemorrhoids, there's cancers. And that's not to scare people, but that's also the reality, because people are so scared to talk about these taboo subjects about, you know, no one wants to talk about poo.
No, they
does.
don't. But why is it such a taboo? Because we all do it. And we all, I agree with you there. And I think you're lifting the lid off that. And I'm really proud of you for that. That's amazing.
Thank you. But yeah, and I think, well, if I've been dealt all this rubbish to deal with, the least I can do is to help other people. If it's going to give it to me that's a chronic overshare and thinks I'm helping someone by speaking about it, then I'm serving my purpose.
Exactly. If you can
help someone else.
Yeah, if one person's listening to this and it makes them go to the doctors and get checked out, whether it's for, as you say, if you've got blood in your stools, always just go to your GP. They've seen it. They'll see it day in, day out. Like, they don't care. Like, as in, you just go because it's better to be safe than sorry, always. Yeah.
Absolutely. And look, like I said, blood in your stool doesn't always mean Crohn's, doesn't always mean bowel cancer. Things like hemorrhoids, and people get embarrassed to talk about those, but they can become really debilitating for people, and constipation. I'd also go coupled with a symptom diary as well. So this is something that people with chronic illness generally find really quite hard to pinpoint their diary. So whether this is like a happy or sad face each day, or literally print off a piece of paper and write your symptoms down of each area of your body that it's affecting, because going back to Crohn's, it doesn't just affect mouth to bottom, it also affects your joints. So you get arthritis, you get inflammation in your eyes, you get mouth ulcers, horrendous fatigue, all these vitamin deficiencies. And people don't realise that it isn't just the bowel,
it's a full body condition. As I say, a chronic illness as well. That's what, chronic for the whole body, isn't it?
Yeah. And when we think, thinking back to when we were talking about, your conditions with FND, yes, it's when you go to a neurologist and you explain your, the symptoms that we would associate with your brain.
Yes.
But actually, you've also got these bowel symptoms, you've got these heart rate symptoms, you've got all of these collection. But because you're only going to see that one specialist, the NHS isn't set up to deal with a chronic illness that affects your whole body.
Oh, I'm so glad you said that, because we don't see it as a whole body condition. You see, so for you, I have IBS, but that's coupled with FND. So FND, then you've got the cardio. You've signposted to so many people, aren't you? Whereas do you think that you would probably change that, wouldn't you, within the NHS?
Absolutely. But that's the biggest thing I would say, is that if anyone has any of these symptoms, and check out the Crohn's and Colitis UK website if you are worried about any of those symptoms, because they have a symptom tracker, and you just fill out a couple of questions and it tells you straight away something you can print off to take to your doctors. It pinpoints your doctors in, the idea of, right, let's get these blood tests done to rule out if you've got any, inflammation in your body. Let's check your stool. Have you got inflammation in your stool? Let's check for the blood content in your stool. So there is those things, and you can literally print it off and take it to your doctor. If you are worried or scared or embarrassed, please don't be, because they've seen, like you said, they've seen this all before 100 times over.
And although it's like, for you, it feels so alien and so new, to them it really doesn't. And I agree with what you're saying with the symptom diary, and I think I'll tag the colitis and Crohn and colitis, I'll tag that in the bio and stuff. But I also think there's ones on Amazon, if you've got like £5, they're like a symptom book. You can just buy it and tick it off. Or I think there's apps if you're able to do that. There's one called Bearable, I think. It's free. And you can, but obviously it's really hard when you're first going through it, because you almost don't want to admit it. And I don't know if you went through that, but I think it's the best thing you can do. We've got to advocate. I don't know if you would agree with that, for our conditions.
Absolutely.
Like, you have to share that journey, and you sharing it is incredible. I just wanted to ask, what made you start sharing your journey and story online?
So it was back when I was in hospital in 2022, and it was like I literally put a post on, like, I hadn't posted anything in the past about my health online. Those that knew me personally knew I've been struggling with my tummy, struggling with these symptoms for a long while. But then I put this post on of, the majority of the last 12 months I've been told you don't look sick, yet my body's literally failing me from the inside out. And the amount of people that had messaged me after that, oh my God, Soph, I didn't know you were going through all of this. And I literally put a like list of, you know, I've got you going to the toilet over 20 to 30 times a day, blood in my stool. I'd put the, like, you could see the inflammation in my eyes where I'd got like all these red eyes, the joint inflammation where my joints had all swollen up. But from an outside picture, you couldn't see it. And that was kind of like the first time that I posted anything about it. And that was just on my Instagram to like my family and friends and those that know me to say, like, yeah, like,
I'm going.
because I was getting really paranoid of like people being like, you look fine, what's wrong with you? Pull yourself together because you look normal.
Yes.
If normal exists, you look normal.
Yeah, no, do you know what?
I don't know if you ever get this as well.
It's almost like right, this is how I describe it. Like, I don't feel disabled enough to be disabled, but not well enough to... And it's almost like I feel like I have to prove it to people. And I know no one else thinks that. I know, maybe some people might not understand, and I think if they don't, my advice, if friends and family don't understand, then it's time for you to walk away from that, or in my case, roll away from that friendship, because it's all friendship, family. You know, you can't keep explaining to someone what's going on with you, can you? If you agree with that, no, exactly. You've got to walk away from that. But most people, they want to hear it. Like, they're like, oh my God, you're going through that, but they believe you. But you, in our own head, we think they don't believe us. If you're right with that.
And I think exactly what you hit the nail on the head there is that when people say, you know, you feel that you have to prove it, because whether that's because you've been brushed off by healthcare professionals or you don't feel it yourself, you know, you think, but I'm not as bad as those people. Yeah, I've got these symptoms, but I'm not as bad as those people. You know, I am feeling like a fraud as such. Yes, and you feel like you need to be like, no, I promise you I'm not lying. Here's the evidence I'm not lying. Like,
God, baby, no, it's so true. But I don't know why we are like that. But, well, actually I do, because I think with conditions, and you've spoke about it on your social media and I have as well, they're not... The problem with our conditions is they're not visible. Obviously, I'm in a wheelchair. You do have a feeding tube. They are visible things. So we obviously are a bit different to other people. You can see those things, but no one can see pain. I always say that. No one can see your pain and how you are. And I bet fatigue and managing work with you, and you do have a really big following. Look, you should be proud of yourself. You've done well with your TikTok, haven't you, really?
To be honest, that was never the intention. It's never been something that I've looked at and been like, oh, you know,
well done.
How many followers are there, kind of thing. It's more just a case of it actually helps my mental health by putting... I think I did a video about this not long ago. It's actually helped my mental health so much more of putting the worst parts of myself on the internet, because I don't care what anyone says, because I've talked about my bowels falling out my backside on the internet. What have you got to say about me?
Yeah.
Come on.
Or, you know, like, I was like, they say if you're going to post something and you're going to worry about those people who are going to judge you, they're not the right people for you. So just think, and like you just said, what is the worst that can happen? Like, for me, I do find, so I don't know if you agree with this sometimes, I try not to, so I don't really post my seizures online. Yeah. Some people do, but I just haven't got that confidence yet. And I was on like the Doghouse with Channel 4, and I was like, can you remove my seizures? And they were like, it's already in there. And I was like, damn it, like, you know. But then I thought, actually, why am I hiding away from this? Because this is the condition. Like you're saying, why not share it? Why not? Because you have helped so many people. Obviously, about the following, you don't care.
And yourself. Yeah, and yourself. Because...
Why not though? Why shouldn't you do that? And I like looked at your whole TikTok and I thought, I'm not alone. Like, you could literally help someone in their darkest moment. Like, what an achievement! Like, you do that. Talking of that, let's go into work. So you actually work with your illnesses. So I should say. How are you supported? How are you able to do that?
It's been a struggle. I'm not going to lie about that. I have, especially the last 12 months, I've found it really, really challenging, and I didn't want to admit that I'd been finding it challenging. I had a period of time, up until about 18 months ago, there was, you know, a couple of years where, I knew I got POTS, I knew I got Crohn's, and things were like, I would say, pretty stable. You know, my meds were working, my medication for my heart rate was working, and I was okay. You know, I'd got back into like doing a bit of exercise again, and I was pretty stable. But then just over 12 months ago, things just randomly out the blue started to take a downward spiral again, and this is when like the gastroparesis symptoms started getting worse, when like my bowel was prolapse and getting worse, and I tried to keep pushing on through work, and I would be at work getting adrenaline to get me through the day at work, because that's one of the things with the POTS subtype I have, is that I have excessive adrenaline, which I think is what pushed me to do so much for so long. Yes. But also in the bad side, I crash so badly. So like at the end of my day, I'm no good to anyone, you know.
Just lie in bed. Almost. Yeah.
And I was in a long distance well, I'm still in the relationship, but we're no longer long distance. We live together now.
Oh, congratulations!
So yeah, it was lovely. It was lovely. But last year I was living alone, so you know, going to work and coming back, and all I would do would sleep for like 12 hours until my next shift the next day. It would get to a weekend, I would sleep. I was starting to bleed with my Crohn's again because I was pushing myself so much. Didn't want to let people down at work because there was other like, you know, other factors at work that were going on, and I knew I didn't want to let the patients down, so I was still taking myself to work. And my colleague got married last year, and literally the day she came back to work was the day my body went, well, someone's back now, crash. And I literally got admitted for like 5-6 weeks to hospital after that, and everything had just got so much worse. And I think that was kind of another point where it, again, a bit like it did in 2022, it really scared me of like, okay, so now not only I've got the heart rate issues to deal with, I've got the Crohn's to deal with, my bowels have now stopped working, I need a feeding tube, I can't eat. And again, like I've found that really challenging. So like from September till January, I took that time off work.
Good.
I was signed off on that time.
Yeah.
And then I had, you know, all good intentions. Like February, went back to work. I managed 6 weeks after a phased return before my bowel shut down again. And I ended back up in hospital for just under a month again, in like end of March and April. And then got the gastroparesis diagnosis. And, you know, I'm still now getting back into the swing of work, and I've had to admit, and I've had a real knock on my mental health from a work side of things. Like you know, when we spoke about anxiety and depression in the past, that was fine, but the whole like you know, getting back into work and having to admit I can't work full time, have a life outside of work where I'm able to do something at the weekend. You know, my birthday was a few weeks ago, and I've been saying, oh, you know, go shopping, and I've still not felt well enough to do. And it's like 3 weeks later, and I'm like, this is ridiculous. Like I'm dragging myself into work. I've had this call with you, and then I'll be like asleep and dead to the world for the rest of the evening. And I have made changes now. I've spoke to work.
Okay, and they understand.
They're really supportive in the aspect of like changing around my like work schedule and giving me like a couple of days on, a break, a couple of days on. So
good.
I'm hoping that will help. But it's so hard. It's so challenging, and I do feel like in my head I'm like, you're not failing. Remember what you're still doing with what you dealt.
I was just about say, you are amazing, and I know anyone listening to this, like, I'm unable to work. You are, let me tell you, you are amazing for doing that. And if it means you have to, I mean, you're in, listen, most people wouldn't even get out of bed with how you feel, and you're going to work. Like, you should be so proud of yourself, because look how you can work. That's like an inspiration for me and a goal for me to potentially be like that, because you should be, and you're helping other people. Like, even not just online, but at work as well. Like, you're a real life hero. That's it. I don't care what anyone says. That's it. But with the, you know, like the fact that you are going and you're sleeping so much, is fatigue like a really big, because it is for me, it's probably one of my really prevalent like parts of my condition. Is it really debilitating for you?
Yeah. And I think that's been the realisation, because I felt, I don't know if you're the same to me, but you know, I've learned to deal with pain and symptoms for so long, is that if I'm in pain, fine, I'll just take a couple of extra painkillers, I'll push through. Fatigue, the only way that I can describe it, which I've seen it described before, is you've got the flu, you've not slept for 3 days, and everyone still expects you to work or live life as if you're healthy.
And you can't, like...
And you can't.
And it's like factoring in, so you do something fun, I'm going to have a week. Like for me, I'm going out Sunday, so I've got this call with you, and then I'm doing nothing. Like, apart from a doctor's appointment. Like, I mean, obviously, podcasts, to most people, this would be nothing, but this is like tiring for me and you, isn't it? The conversation part of it.
And even like you said, you know, you've got the physical aspects of the health condition, but it's also the mental aspects of the health condition. And when we spoke about like dyslexia and like the neurodivergency side, having a brain that's going around 20 times faster than the next person's is exhausting.
So exhausting. And I think anyone listening to this like probably thinks, what are you like? If you don't have the conditions, you don't understand it. I get it, but also managing chronic illnesses, horrific. Appointment. How do you fit that in with work? Are they understanding if you've got an appointment you don't? Yeah. Okay, good.
It is a positive that half of my appointments are at my hospital that I work at. So I'm like, I'm just off to gastro or
that's brilliant.
Just off to rheumatology. So yeah,
that's good. And if there's like something you've learned over your journey, like what's the like one thing you've learned and you'd love to pass on? I mean, one might be a bit hard to, but what's like the main thing you've really learned over your journey and you'd love for someone to take away from this podcast?
I think I'm probably still learning it, but I'm getting there. But it's to be kind to yourself. That, like you said, be kind to yourself. You're your own advocate, and learning to listen to your body is not defeat. It's not failure. It's actually the way that you start to, you know, live life around your conditions, because we can't take them away. As much as we all wish we'd got a magic wand and we could take it away tomorrow and go back to our previous, like you said, you know, as a VT, running around, fitness, pushing yourself to the limit, doing everything for everyone else, but just learn to be kind to yourself. I'm still learning. I'm not quite there.
We'll get there, right?
We'll get there. Yeah.
We'll do another podcast in 2 years and we'll be like, yeah, we did it. No, I don't think you learn. I don't think you know how to do that. But obviously it sounds like you've got a brilliant support network. Am I right in saying that? Yeah, your partner.
I'm so lucky. I don't know if it's the same for yourself, but if it wasn't for like my family, my partner, they are amazing. They're so understanding.
Same, like my partner, he'll always say he'll carry me up like Kilimanjaro if he had to. He's brilliant for that. And does he help you with your medical, or your partner help you with your medical, like sort of your feeding tube, things like that, or?
Yeah. So if it's blocked, I'm like, Craig, please, can you unblock it? I can't do it. But he won't mind me sharing, because I've spoke about this on my post. I don't speak about it too much because it's his life, but he also has Crohn's. So for me, having someone to speak to that also has Crohn's and understands, he is luckily like in remission, not on any medications, great, but having someone that understands, of like, it makes the world of difference.
I bet that is like a really good, because it can cause arguments, it can cause breakups, it can, you know, you're dependent on that person. Almost he's helping us, not my partner, they're helping us be medical, like they're almost a bit of a doctor, and they have to do things that some people, he has to see things he never wants to see, you know what I mean, with my bowel, and because same things, do like irrigation, catheter, all those amazing lovely things, and he has to see that, and no one wants to see that or help with that. But if they're there, I always say, if they can be with us in these hard times, man, if it gets a little bit easier, girl, we've made it, haven't we?
Yeah, exactly. And that's a good saying as well. We do say this ourselves, that if you can't be there for each other at your bad times, you don't deserve each other at your good times.
Yeah, I love that. I love that. I'm going to take that. That's a good thing to take. And I haven't really talked about it, but I would like to, just quickly before we finish, if you could talk about your feeding tube and sort of just where that came from and how you deal with that on a day-to-day basis.
Yeah, so I got to the point last year, in all honesty, I think I've probably had gastroparesis for a long while. Whether it's come from like the EDS side of things with like the connective tissue problems.
Oh, is it linked?
There's a really big link between that. Or whether it's come from Crohn's and like the physical damage to my stomach. We don't know for definite which it is. You know, some people get gastroparesis with diabetes if the nerves are damaged. Some people have it in addition to things like yourself with FND, because a lot of these problems with gastroparesis, it's the signals that are coming from my brain to my stomach. It's actually those pathways that are broken, that don't want to work, as opposed to the stomach itself is structurally normal.
Yes, but it's not actually. I didn't know that. It's a bit like the FND side of things, but it's just not firing properly to communicate.
No. Wow. And because structurally sound, in medical terms, doctors say you're fine, as we get in FND, POTS, IBS, gastroparesis.
You're
structurally,
you're not.
Yeah, but you're not.
Yeah.
Yeah, so that was what happened to me. So I am at the point now where, for some people, they can't tolerate anything orally. I can have small amounts of drink, small sips at a time. If I have too much volume, my body goes no, and I'm sick. I get majority of like my calories through my feeding tube, but at the moment, I'm trying to integrate like normal food back in. But it just, when I did my study, all that happens is I eat and food just sits in my stomach for hours and hours and hours, until literally hours later I'm either sick or it causes me symptoms in that time. It just doesn't go anywhere.
Oh, really? So you're not getting the nutrients, is that right? So that's why they give you the feeding tube.
The feeding tube, yeah. So mine goes directly into my tummy.
Yes.
I should, in theory, have one that goes straight into my small bowel, but again, the way that they look at these things is your weight the same? Well, yeah, because I suck on sweets because my blood sugar gets so low that I feel like I'm going to faint. So, that keeps me going. And, sugary drinks and things like that. So, but, so feeding tubes are there for so many purposes. So someone might have had a stroke, they can't physically swallow. Someone might have a paralysed tummy. Someone might have had like an operation to remove part of their stomach for something like cancer.
Yes, and that's why they have.
Yeah, so there's lots of different feeding tubes. So mine on my face is what we call like a nasal feeding tube. So this is an NG.
An NG, yeah. I think I've seen that on your NG. I've learned that.
Yeah, and then if it goes from your through your nose and then into your small bowel, that's an NJ. So that's going into the first part of your small bowel. Wow. And then might have also seen them where they come directly through the tummy, and they're kind of pegs or rigs, dependent upon if it's put in with an X-ray or put in under endoscopy. And again, similar process. They're either going directly into the small bowel, directly into the stomach, or you can have tubes that go in both. Again, people don't realise how many reasons there are for feeding tubes. There's obviously eating disorders as well, which is, sometimes I do get questions asking, like people messaging me like, have you had an eating disorder and that's why you've got it? And I'm like, no, I'm very thankful that that's not why I've got it. But again, that's another reason why people can have feeding tubes. So
I didn't know that.
Reasons. Yeah.
And also because you can see it, I mean, I don't know if many people do ask you in person why you have it, or so you obviously, I mean, you sounded so knowledgeable then, so you've informed me and probably a lot of other people. Like, honestly, I didn't know those things. And if you don't mind, like, how do you overcome the fear of a feeding tube? Because I think that's obviously a big thing, right, with it. Yeah. How have you overcome that?
I must admit, the very first time I had one put in, I was like holding my mum's hand, like panicking a little bit. But I had similar, it wasn't feeding tubes, it was for like monitoring and interventions. I'd had them in for a period of time in the past, but only like a day or two at a time. So I kind of knew the process, but I was very scared when they told me that was the process that I had to go down, was to have the tube in place. But it was very much then so come on, it's mind over matter. You can do this, mind over matter. They're not going to give you something that's going to stop you from breathing. You'll be okay. And it is the weirdest sensation. I remember those first couple of nights in hospital thinking, oh my God, I've got this tube in my throat. And
I got you can't figure out. And now do you do it yourself?
So I don't put it in and out myself. I'm not trained, so one of the perks again of working at the hospital is I go to the enteral nurses there to get it changed. I mean, they are supposed to be in for up to 3 months, but I'm very lucky if I can keep mine in for more than 2 or 3 weeks without vomiting it up, because I get that much sickness.
Oh no.
But yeah, they are generally a short-term option.
Okay.
The longer-term options are the surgical, like feeding tubes.
Okay.
But I'm just kind of watch and wait to see what, you know, from my last appointment with the consultant, what the plan is going forwards. But yeah, that's what they are. So, you know, I've had patients ask me at work, because that was something I was really worried about going back to work, and like, oh my god, the patient's going to think I can't do my job because I've got this big thing sticking out my nose. And I don't know whether it's an acceptance thing. I don't know whether it's how people see me, like if I just prefer it. But I try to wear like nude tapes over mine.
Yes.
Nothing against anyone wearing nude tapes, nothing against anyone wearing like coloured tapes. It's just, it's not really me. And I've tried to like
make it you. You've got to make it you. Same as like with any mobility aid or assistance, it's got to be an extension of you, hasn't it?
Yeah, exactly.
I agree with that.
Exactly. Yeah. And if you want to have, you know, with like a cane, if you want to have a coloured cane, go for it. Yes. If you want to wear bright tape on your face, go for it. If you just want like a plain, less medical looking one, great. But I personally try to not hide it away, but I don't want a patient to come to me and, you know, them looking at me and thinking, oh, what she got sticking out her nose there. Yes. I want them to come to me and think about the fact that they've just had a heart attack and we're here to talk about them.
And take it away from you, which again, let me just say, amazing. Like, I see why you'd want to do that though. Like, I understand how you, and obviously it may be in a couple of years' time. You might be, well, hopefully you won't have it. I don't have, but maybe you might get into wearing a wacky colour or something. Yeah. But right now, this is working for you, and this is how you're living with the whole thing with chronic illness is learning to live with the disability and chronic illness, isn't it?
Yeah. And no two people with the same condition have the same symptoms and the same day to day, because the same person can't compare day to day. So how can we possibly compare two people day to day? We can't.
We can't. Oh, that's so well said. Like, honestly,
rehearse that one.
Yeah, you knew that. That's ticked off. I was about to say, what message would you like to give to anyone who's listening to your journey and feels alone in their health journey, as our last question?
You're not alone at all, even the most embarrassing things. So I think I'm pretty open, and I struggled to talk about my bowel being prolapsed because I was so embarrassed about that. But me opening up about that, I've spoke to so many people. So even something that you think is the most embarrassing thing or the worst thing to you, if you can find someone on social media that's not advertising, that's the wrong word, but like showcasing, sharing about it, they are probably more likely to have and engage in a conversation with you if you've got those questions, because it's easier to go and speak to a stranger on the internet about it.
Yes.
Check the advice that you're given. You know, don't take it as medical information. Yes. Check it against with your doctor. But if it gives you then the confidence to approach that situation with someone, because you're not alone, you might think you've got the worst thing, but there is someone else out there that, you know, might be able to help you or listen to you. Yes. And don't shut yourself off from the world. And I think so many people with so many health conditions do get shut off by doctors straight away, and advocate for yourself, like we said earlier. They're the biggest take-home messages, I think, is just be your own biggest advocate, and also don't be afraid and embarrassed and frightened about symptoms. You know, that have a look for other people. Like, that's why people, I mean, I didn't set out to start off with that this was going to be where I am, but I'm so glad it is, because every single time, I don't know if you're the same, every single time someone messages me to say thank you so much for sharing that, or you talking about, you know, your wheelchair, and you know, thank you so much for sharing about this, because I now don't feel alone, or I'll go and speak to my doctor about it. It's, you know, it does give you a good purpose, doesn't it?
It does, and it changes. I had someone message say about a wheelchair. They've got the same wheelchair, and it made me feel so happy. And I was having a really bad day, and I just thought, if we are what we're doing, we're not doing it for me and Sophie. We're doing it for other people, because the more we talk about it, the less it's a taboo. That hopefully we can help and save someone else's life. Because we're not alone. It might all be virtual, and that's okay in the chronic illness world. But what an amazing thing, because I wouldn't have had this years ago. So we're doing it, girl.
Exactly.
I just want to say thank you so much because I've loved. I could talk for longer, honestly.
Honestly, I'm so sorry. I've just seen the time. I've talked your head off. I'm so sorry.
You haven't, and I'm sure everyone listening has enjoyed listening to you because you're so informative for one, positive, but also real, all in the same bracket. And I've just loved talking to you. So thank you so much. Yeah. That has been the beautiful Sophie. I have been Simone, and you've been listening to Cool and Chronic. Thank you. Bye bye.